I'm delighted to be joined today by Wendy Parmet, who is the Matthews Distinguished University Professor of Law and Director of the Center for Health Policy and the Law at Northeastern University. Among many important articles and books, Wendy's the author of Population, Public Health and the Law, published by GU Press in 2009. Thank you for being here today, Wendy.
Thank you for having me. It's a pleasure to be with you.
Thank you. So I'd like to start by asking you about your book. You describe your approach as population-based legal analysis. Can you explain what you mean by that term?
Sure. So most simply, this is an approach to legal analysis, both for courts and for commentators. And it's based on existing Anglo-American legal doctrine, but it pulls out of it three important components. First, it accepts that population health is an important goal for law, or to put it another way, public health is a legal norm. It's something that courts care about, that our laws strive to safeguard. Doesn't mean it's the only value. It doesn't mean it's the overarching value, right? We have other values: equality, due process, right? Fairness, lots of values, but it is a legal value. Second, it premises that courts should adopt public health's population perspective and think about how laws affect individuals and health from a population point of view. This requires courts to not only see individuals as isolated, not only see the risks they face and the choices they make as solely their own, but to recognize the way that forces operate at a population level that helps situate individual risks and choices. And we might be able to come back to that, but it's something we're seeing so clearly today with COVID-19. And third, population-based legal analysis contends that empirical evidence matters, and that where relevant and available, it should inform the law. In other words, if a goal of the law is to protect the health of the population, well, it should matter what we know. Science matters. Again, it's not the only factor. And in some situations, courts rely on it more and some less, but it matters. What we're trying to do is protect the public's health in law. Then it matters what we know about the science, what the science teaches us about how to do that.
Right, thank you. So we're going to come on to the current crisis, obviously something we have to talk about, but I was wondering if we could just take a little bit of a historical approach for a second, and if you could describe what the role of the federal government has been in responding to public health crises historically.
Well, the history of American law, American constitutional law with respect to public health is a fascinating one. Health crises have helped to shape our history and certainly our legal history in important ways, but it's also been always a history of struggle and of tension between the various jurisdictions, between the branches of government, between the states and the federal government. In our constitutional structure, the protection of public health is understood as primarily belonging to the states. It is part of, indeed, a core component of what we call the state's police powers. These are the reserve powers, the powers the states retained, actually as attributes of their sovereignty when they joined the Constitution. And throughout history, states have played the primary role in protecting their populations from public health. Vaccine laws, quarantines, restaurant licensing laws, medical licensing laws, medical malpractice laws, these are all state laws. That said, the powers that the Constitution granted to the federal government are quite robust. And although limited, they're plenary where they exist. And these include the powers to tax and spend. And we know the federal government has a lot more money than the states, and it can go into deficit spending. And it can do a lot, right? It can accomplish a lot of regulation through its spending. And the federal government also has the power to regulate interstate and international commerce, as well as immigration. Excuse me. Since the beginning of US history, the federal government has used these powers to protect public health. We see that even if we go as far back as to the 1790s. But in the 20th century, the federal government's role with respect to health increased dramatically. For example, the Food and Drug FDA was established early in the 20th century, and it now regulates pharmaceuticals and vaccines. The CDC, and it has earlier roots, but was established as it is in the 1940s. It offers technical guidance over many matters of health, and it exercises the federal quarantine powers. And what I think it's important to understand is that in the recent decades, we've really come to expect, despite the constitutional structure, that when major health problems arise, the federal government will play a lead role. Only the federal government has the power to coordinate a national response. Only the federal government can regulate pharmaceuticals and vaccines and invest heavily in their development. Only the federal government can deal with the international, global aspects of an outbreak. And of course, the federal government as largest payer of health insurance through Medicare and Medicaid also has tremendous influence over our health insurance system. So we really have come to rely on a federal response, and state and local governments, although they are sort of the actors, the primary actors, they really rely on the guidance that the federal government gives them. Unfortunately, in this crisis with COVID-19, we're seeing so many different areas in which the federal government did not step up to the plate, where it did not play the coordinating role. And that has led to a lot of our problems of where we are, why we are where we are today.
Yeah, thank you. So I wanted to read a sentence from your book, which our viewers will remember from the introduction was published 11 years ago. And the sentence is, "What is new today is the degree to which uncertainties over federalism threaten to disable both the states and the federal government from undertaking public health measures." That seems extraordinarily prescient. So I was wondering if you could describe, how we got from 2009 to the kind of chaos we're seeing in response to the pandemic today, with seemingly every state, even cities, all having their own policies and making it very difficult for citizens to kind of keep track.
Our system, our constitutional system, was established as a system of divided powers. Contestation was sort of baked into it. But in a simpler time, I think that had less calamitous effects. As the economy has become increasingly interconnected, as travel has increased, as the complexity of our problems has grown, the frictures and tensions that are built into our constitutional structure that really have always been there are exact a heavier toll than they have been. And one interesting thing is to note is that, starting in the late 20th century, the Supreme Court, during the Rehnquist court period, really tried to revive federalism. This was an important, I think, goal of the Supreme Court, and they issued a series of opinions that really emphasized the limitations of the federal government's power in ways that really, in a sense, pushed back against the growth of the federal government that we saw during the New Deal and Great Society periods. That development, I would say, perhaps reached its peak in 2012, post the Rehnquist Court, in the National Federation of Independent Businesses versus Sebelius case, better known as the Obamacare case. It's actually the Supreme Court's first Obamacare case, where the court held that the federal government could not require states to expand their Medicaid programs. in language that really called upon, again, this idea of states' rights, of police power, of the federal government can't go too far. Whatever one thinks about that, I mean, the problem is when you've got a crisis that's fast moving, extraordinarily complicated, extraordinarily expensive, requires a lot of money, a lot of expertise, there's a lot of moving parts. The way we have now, those tensions of federalism become, right, more costly, right? The idea that, you know, states shouldn't have to be forced to have Medicaid. Well, now today we see the price of that, because we see, you know, lack of uninsurance rates are going up in those states everywhere, but particularly in the non-expansion states, right? We see that even in the midst of a pandemic, people are having trouble paying for healthcare. So the tensions of federalism exact a greater cost during a crisis. On the other hand, I want to say, it's important to note, there are some positive aspects about the tensions of our federalism. And, you know, many of the states stepped up when the federal governments did not, right? I mean, the fact that states are quasi-sovereign entities, the fact that they sort of own the primary responsibility for the health of the public meant that governors did not sit back and do nothing when the federal government was not. And the states, you know, I don't know what would have happened. The models are pretty scary if, you know, the governors of California and New York and my own governor in Massachusetts had not issued social distancing orders in March, right? We may have had many, many more deaths. So, and by the way, the fact that different governors were doing it somewhat differently, they learned from each other in ways that replicate Justice Louis Brandeis's idea of the states being the laboratories of democracy. And of course, there are reasons why, you know, the situation in New York is different than the situation in Alaska. And it makes sense to have some differences. So there are benefits to our federalism, but there are also, and we have felt them, severe costs.
Thank you. You know, it strikes me that we've seen, you know, incompetence in the federal response to disasters in the past. You know, Puerto Rico recently, Hurricane Katrina before that. But in some ways, the federal government's response to this crisis seems to be, you know, what crisis? And so I'm just wondering if that kind of almost like an abdication of responsibility at the federal level is something completely new, or whether there is precedent for that.
Well, the federal government really did not step up in 1918 during the influenza pandemic of 1918, which was totally horrific. Mm-hmm. But I don't think I can think of something with this magnitude in the, you know, in the last century. That was more than a century ago. And of course, we've come to expect more from the federal government now. The failure, particularly of the CDC, its missteps is truly, truly shocking. Not that the CDC always gets it right. It certainly hasn't, and we could talk about other cases. But I think that state and local health officers and the public had really come to expect that the CDC was the place you went to. You know, you listened to CDC briefings to get the evidence, to get the facts, to understand. You think about all of the information the CDC was giving out to the American public during the H1N1, during Ebola. And the CDC disappeared for much of this spring, right? It really disappeared. And it wasn't there to guide. And even the guidance that's been issued now is still shockingly thin. Mm-hmm. And I think that this is really, so I don't think in the modern years, at least in the last 100 years, we could say we've seen this level of negligence and even malfeasance from the federal government. We certainly, I don't think, have had another situation where federal officials have promoted clearly inaccurate information about a health problem. Sometimes the early information given proves not to be correct in hindsight, but I would say I can't think of a situation in which health information, which was known to be inaccurate at the time, where there doesn't seem to be a felt need to offer the best evidence.
Yeah.
This feels very different and very troubling.
Yeah, thank you. So I wanted to turn now to some important court cases over the last few months that I think looks like will be relevant for us going forward as states kind of start and perhaps stop again. So I think both of these cases were in May. So in the first one, the Wisconsin Supreme Court ruled that the governor's stay-at-home order was illegal. And I was wondering if you could talk us through a little bit of the case and then the court's reasoning.
Well, I think it's a really interesting case and very troubling in a couple of ways, because it really sort of underscores some of the challenges our country is facing, some of the reasons why this moment is so perilous. Just first stop and note who brought this case. This case was brought by the Wisconsin legislature against the Wisconsin governor. And, it's not like that hasn't happened before in our history. Of course it has. But in a moment of crisis, of 115,000 people have died in the last 3 months. This is not a trivial moment. And millions and millions of people have lost their jobs. In this moment of crisis, the partisanship and the partisan dysfunctionality that has affected some of our states made it impossible for political leaders to get together and to agree upon anything. And so they ran to court. And that alone sort of tells you where we're starting, right? On its face, the opinion of the Chief Justice, Justice Rogensack, was pretty technical, in the weeds, lawyerly, based on administrative procedures grounds. The court said that the social distancing order of the Wisconsin Secretary of Health, Secretary Palm, was a rule and hence subject to so-called notice and comment rulemaking, which she did not follow. And that all feels like, okay, administrative law 101, snore, go to sleep. But there are a few other parts of that decision that were, I think, quite remarkable and troubling from a perspective of population-based legal analysis, if not any other perspective. First, despite the sort of technical part of the opinion, the Chief Justice emphasized the importance of construing the Secretary's authority narrowly in light of concerns about separation of powers. And basically said there's no health exception to constitutional safeguards. This part of the decision, I think, suggests that even if the Secretary had dotted her I's and crossed her procedural T's, Chief Justice and the majority would have come out the same way. Okay, really there just was no authority to do this. In a similar vein, in a remarkable concurring opinion, Justice Bradley analogized the Wisconsin social distancing order to the internment of Japanese Americans in World War II, and cited and quoted the Kawamatsu case and other, I would say, notable cases, the parades of horrible cases. Even more clearly than the Chief Justice, Justice Bradley saw the health orders as a fundamental violation of liberty that demanded the courts to step up. And what's absent from that decision was any recognition, and this gets straight to population-based health, that liberty is complicated, right? Where is the liberty of people to be free from the pandemic? Where is the liberty of other people to go outside, not having to worry that everybody around them is sick, right? There's no discussion of the fact that this is complicated. You could come down on either side, but liberty here is complicated. And people, as the Supreme Court had recognized back in 1905, in Jacobson versus Massachusetts, real liberty exists under law. Right? Real liberty is not just everybody getting to do their own thing. And this was a remarkably libertarian concurring opinion. And then finally, despite the fact that the Chief Justice, in her own concurring opinion, said that supported the idea of issuing a stay of the order to give the governor and the legislature time to try to work things out. The court did not issue a stay, meaning that the social distancing orders ended abruptly. Court issue, no rules, go party in the bar, no need for any social distancing, no nothing. Again, as if the health consequences just didn't matter at all. No concern. And so that was a rather remarkable decision. To be clear, it's not the way most courts that have looked at social distancing orders have decided. The vast majority of courts have upheld the orders. There have been some exceptions, and we could talk about them. But this opinion was rather remarkable in its neglect of the context.
Yeah.
We're in a pandemic, folks. This isn't an ordinary day in the spring. People are dying at that point by the thousands a day.
Yeah. Thank you. So we have a question from a participant that asked if you could say something about the tensions, especially legal tensions, between mayors and governors. I think this has probably been most pronounced in states like Georgia, where the mayor of Atlanta has had a very different perspective than the governor.
It has been, and it's an important issue. It mirrors actually a trend we've seen over the last several years in public health law in general. In many states, urban areas tend to have a very different population that votes very differently than the population which actually controls the power of the state. It's true in Wisconsin too, right? Urban populations tend to be more democratic and elect Democrats. We often see more people of color. And of course, the pandemic was, at least initially, particularly striking urban areas. But as I said, we've seen this in the past. And so what we've seen over the last decade or so is an increasing trend to what is often called intra-state preemption. A community might ban indoor smoking, run to the state legislature, disempower the mayor and the local city council. Community might try to tax sugary sodas, same thing. So we've seen this trend, gun control, we've seen this trend playing out in much of the country, particularly states with Republican governors and legislatures that are really heavily weighted to the rural population, that have very different values and concerns about health than in the urban centers. And it's deeply problematic, particularly in a pandemic, right? Where populations that are not feeling the pandemic, it doesn't bother them. By the way, during the oral argument in the Wisconsin case, one of the justices said, well, it's not affecting regular folk, right? I mean, the coded, maybe this is the moment, because the other major issue, of course, at this moment is the racial violence by policing, and the country thinking about, importantly, coming around to think about the deep structural inequities. Well, COVID-19 and all of our health problems affect different communities, and particularly African Americans and Latina, and disparately, and we've seen this. And so the fundamental lack of empowerment that these communities have in the state legislatures, which in so many states are still dominated by more rural, whiter communities, is playing out. And COVID has shined a light on all of the pre-existing tensions and vulnerabilities and frictures and factions in our country. And so we're seeing all of these today. Yeah,
thank you. So we have a few minutes left, and I thought maybe I'd ask you a couple of questions that are maybe a little more philosophical. There are it strikes me that there's a kind of asymmetry in the law around shutdowns or quarantines, that if I'm a business owner, I can sue to get a lockdown lifted. But as far as I understand it, as just a citizen, I can't sue to get one imposed to protect my health or my family's health. So can you talk us through how the law works in regard to who has standing, I guess, to press a case?
Well, it goes to standing, but it goes to a wide range of other issues, immunities, and fundamentally the way our law treats various claims. And it goes back to what I said a moment ago, which is the way we think about liberty. And it's through, it permeates every aspect of our jurisprudence, right? Where the idea is my rights are my rights to have the government not infringe upon me, right? My freedom is my freedom in the state of nature, so to speak, or to use some of the more philosophical terms, we see liberties as negative liberties, freedom from, right, as America. And the Supreme Court has made this very clear in a series of cases, particularly in the Rehnquist era, that, you know, the government has no obligation. The Due Process Clause is a charter, the Bill of Rights is a charter of negative rights. Right. And so this is part of the issue that we see, because governments have power to protect public health, but they have no obligation or requirement. And it assumes, though, that I can somehow protect my own health. And yet, of course, I can't, because we are interconnected. And my health and my liberty depend upon your health and your liberty. And it depends upon the social factors we call the social determinants of health. And it depends upon the prevalence of infection in the community. And in order to have liberty, in order to lead my life the way I might want to and to pursue my own life ends, we need the government to do certain things to take care. Right. And unfortunately, our law really, really struggles with this. It has this deeply libertarian and individualistic bias. Part of what I was trying to do in the 2009 book is both expose that, but also revive, if I can call it that, this other chord in our law, and to show that both are there. And that while the individualism may be ascendant, it is not the only chord. And courts talk a lot about caring about health. But if they want to do that, then they have to understand the interdependency of health. Infection, plague, which is part of the human condition, which has always been part of the human condition, or at least since, you know, people started living together and domesticating animals and stuff, shows our vulnerabilities, right? We are interdependent. And unfortunately, our law does not always recognize that. Right.
So we kind of need to revive a conception of positive liberty, the freedom to be healthy.
Which is part of, you know, I start the book with the common law maxim, salus populi, suprema lex, which is an old common law statement. The common good, the public health, is the highest law. And what I want to suggest is, if we think it's the highest law, then we need to understand that we need some positive liberty, and we need to structure our law and read our law in ways that don't always countermand that. Great.
Thank you so much. I'm afraid we're going to have to leave it there. We could, I'm sure, continue talking all day, but this has been a really enlightening conversation, and want to thank you for participating and being here today.
It's my pleasure. It's been really great to be with you today.
Thanks again.
Stay well.
Stay healthy. I would like to invite everyone to join us for a special Juneteenth edition tomorrow of Books for a Better World. We're going to be talking to Professor Valerie Babb of Emory University about her book, Black Georgetown Remembered. So thanks everyone. And thank you again, Wendy.
Thank you.
And stay healthy, stay safe, everyone. Take care. Bye-bye.